Hospital versus hospice. We look at which one can actually prolong life of a person with heart disease. More people suffering from terminal illnesses are choosing to spend their final hours at home.
That's according to a study that appeared in the Journal of the American Medical Association. A big reason for that, recent changes to Medicare. The #1 killer of Americans is heart disease. A new law allows the government to reduce Medicare funding to hospitals that repeatedly treat the same patients for heart disease. That was set up as a cost-saving measure. Recent data shows those terminally ill with heart disease actually live longer in hospice than at the hospital. TV9's Mark Carlson explains.
Inside Iowa City Hospice, they aren't treating patients. That's because most of their patients are resting comfortably at their own homes, where house calls are just what the doctor ordered.
There's a fear that once somebody comes on hospice care that they will die sooner, and that's not necessarily the case.
Sarah Krieger, clinical leader at Iowa City Hospice, says in recent years there's been a push to steer very ill patients towards hospice programs, particularly those with heart disease.
Patients who have heart disease and choose hospice care live 20% longer than those who have heart disease and do not utilize hospice care.
Recent data from the Journal of the American Medical Association states that early enrollment in hospice care for patients with heart disease is the key to living a longer life.
When people get hospitalized, they tend to stay in bed, they tend to not ambulate, they get weaker. If we can keep a patient in their home environment when it's appropriate or when they wish to avoid hospitalization, they have more freedom.
But hospice providers still face an uphill battle because many people think the greatest care during the latest stages is at the hospital, despite their own wishes.
There is still a problem with a significant number of people dying in the hospital, and studies show that 90% of those people did not want to die in the hospital. They wanted to die at home.
Iowa City Hospice cares for about 120 patients at a time, all with a wide range of illnesses. And the hospice says this data is really proof that the program is just as much about life as it is death.